that I learned that the reason sleep is so incredibly important is because our sleep center in our brain, which we'll get to, actually regulates every single biological process in your body. And that was incredibly enlightening to me, and I'll tell you this, the reason I'm telling you this is really not to speak about where I studied and who I studied with, but it's really about me trying to relate to you that in order to do sleep studies, in order to do experimental studies where you're disrupting sleep, it means you become disrupted. It means you're up all night. And so I'm really coming to this talk from a place of compassion. I know what it's like to have insomnia because I had to have insomnia. I had to sleep through these shifts in my schedule, and I know what it's like to feel like pharmaceuticals are the only option. And I think our most important message tonight is that there's so much hope beyond that. And that's really why I'm grateful to be here. And I want to share with you some of those hopes. So, we all know what it's like when we don't get enough sleep, right? We've all been there. When we don't fall asleep, when we don't stay in sleep, when we wake up too late. So what happens the next day? We don't have our executive functionings. We're tired, we're crabby, we can't remember things, we have no energy, right? And so this is a very common phenomenology in our society today. So can anyone guess how many people experience insomnia?
Everyone.
No. Very good.
Excuse me, everyone over the age of 25.
Absolutely. That's fantastic. It is getting very close to that, as a matter of fact. In fact, 1 in 3 of us right now, as we look around the room, 1 in 3 of us is struggling with sleep right now. And there are different kinds of insomnia, but the reality is we all deal with sleep disruption at some point in our lives, and it can be transient and it can be long-term. So I'd say about 10–15% of us have transient insomnia in that we have difficult falling asleep for about 3 months. And maybe another 10–15% of us have chronic insomnia, which means we've been dealing and struggling with this for months and years. And that's really why we're here tonight, is to speak to that area of suffering and to offer options that honestly work. I've seen it work, and I'll show you it works. But so I'm really happy to be here and to talk to you about that. So if you look at the second page, in order for us to really talk to you about how we can address insomnia in ways that are consistent with integrative medicine, we first have to understand what's causing it, all right? So we need to know what it is we're doing. So we all know that stress is probably a pretty big factor in our sleep. We've all been stressed out, we can't sleep. We've been there, right? We've had those moments where we have a big day the next day, or a big year, or however it happens. But stress is absolutely a key player, and Dr. Bhandari is actually going to get into the physiology behind why that is, and how stress and the stress axis basically inhibits our sleep center in our brain. So I'm going to talk a bit about medical conditions. So we can imagine if someone, for example, if you're feeling stressed out, you don't sleep, then perhaps it makes good sense that if you have anxiety disorders or depression, you're also having disrupted sleep, right? Other conditions, pain. If you're dealing with chronic pain, it's really, really difficult to sleep because you're in pain a lot. So what about if you're in your 3rd trimester of pregnancy? Anyone ever been there? Really hard to sleep, right? Oh, we've been there. Dr. Reeder, tell us about it. It's all worth it. Yeah, so menopause is another time where we experience sleep disruption. And I'm not there yet. It'll happen, but I can tell you every month, right around my cycle, I feel this dip in progesterone and I lose my sleep. So hormones are a big factor in our sleep. Obviously, we know about how medications or drugs like caffeine or alcohol disrupt our sleep. Turns out medications like ADHD or hyperactivity or hypertensive drugs, those all can be very stimulating. Pseudoephedrine for colds. So we're getting a lot of external environmental perturbations to our sleep. What I really want to talk to you about is what we do in our environment disruption and improve sleep quality and sleep efficiency. And for these reasons, that's why I have this slide here. If you look at the middle slide, it's sort of like, what is that? So it's obviously a map of the globe. And it's actually a map of light pollution at night. So it turns out 80% of our globe is now polluted by light at night. 80%. And that's of the entire globe. Guess how many Americans experience light pollution at night? 99. Europeans, 99. That's a lot of light disruption in our sleeping environments. And it turns out other very advanced 24-hour societies have a very high incidence of this light pollution, and as such have a very high incidence of circadian and sleep disrupted disease and disorders. Now if you look at this, you can see the one country, can anyone see the one country that has the least amount of light at night?
Australia?
Antarctica?
Yep, all of those. So Africa and Australia, turns out they have the least amount of ambient light at night. And as such, they have the least amount of difficulty with sleep-mediated disorders. Welcome. Sure. All right. So why do I bring this up? What's the big deal? There's, 24-hour travel and 24-hour lights, and why is this a big issue with sleep? So it turns out that our bodies were evolved to the sun. So back in the day, millions of years ago, we would wake up with the sun and go to bed with the sun. There was no artificial lighting, and there was no cell phones and Wi-Fi and no shift work, right? There was also no LEDs at night. And the LEDs are the lights that are all lighting our environment right now and your environment at home. And the problem with LEDs is they emit a wavelength of light that is very similar to what you see outside. It's called the blue spectrum of light. And that particular wavelength is the wavelength that your brain has adapted to tell the sleep center in your brain that it's daytime. And this can be even if you're, it's 12 o'clock at night and you're looking at your cell phone, and all of a sudden it's this blue light, all of these LEDs emit the blue light. It's telling your brain, daytime, wake up, wake up. What happens? So that sleep center in the brain, as I said, regulates everything, every biological process in your body. And it activates your daytime hormones, your cortisol. And it suppresses your melatonin, which is your sleep hormone. And so that's why I bring to you the issue of light at night. It is a huge epidemic. And what we're finding now, and it's not just epidemiologic, what we're finding is individuals that have continued to do shift work at night, nurses, doctors, service, first responders, all of these individuals, what we're seeing is they're developing heart disease, cancer, they're developing diabetes, they have increased development of depression and gastrointestinal disorders. And it's because there's a circadian disruption in the sleep center, and it's the sleep center, again, that controls the periphery of the brain and every single process in your body. So that's why it's so important to understand what's causing the sleep disruption and why our cell phones and our computers are contributing to that. Does that make sense? So we put in this second slide here, and I just put this in because I want you to know I'm not making this up. This is a study that was just done recently at Harvard. And what they did at Harvard Medical School is they exposed individuals to various spectrums of light. And what they found is that individuals that were exposed to wavelengths that were in the blue visible spectrum ended up having the most sleep disruption, which went down when it was green, and then it went down even more when it was red. And so I can tell you, in my studies, we found that as low as 5 lux of light, which is a simple little candle, that was enough to completely disrupt the endocrine system. And so that's why I want to impress upon you how important this issue is in terms of disrupting your sleep. And and that you can absolutely resolve this. There are simple behavioral interventions that we can do to help mitigate this effect. We put in this slide because I wanted you to think about, when we think about our cell phones, might there be any other reason why we don't want that in our bedroom? Or any sort of electronics? Any thoughts about what else our electronics emit?
Yeah.
Excellent. That's right. She said EMF. Does everyone know what that is? So EMF is electromagnetic frequencies, and it's essentially energy waves that is emitted by every single electronic that we're surrounded with, particularly electronics that are close to our body and when we're sleeping at night. So if you look at this, it's very difficult to see. It's very, very small, but it's just a spectrum of how much EMF or electromagnetic radiation is being emitted by our electric devices. And it turns out the cell phone is there was another study done by MIT with cell phones where they showed that the radiation that was emitted by cell phones was enough to not only decrease sleep, but it also took longer to get to the quality sleep and the deep sleep stages of our sleep, and then they lasted much shorter. They didn't last quite as long. There's been so many other studies that have demonstrated that electromagnetic pollution, we call it electrosmog, actually can also cause not only just sleep disruption and headaches, but it also causes, it's been suggested to cause ADHD in our younger individuals. There's been some very conclusive studies around cancer, head cancers from holding your phone this much. There's a new study that just came out where a woman put her cell phone in her bra, same place every time to go running. Ended up developing primary tumors precisely where the phone was placed in her bra every day. So more and more we're seeing all of this environmental pollution, albeit light or electrosmog, that's disrupting our sleep and when we disrupt our sleep, we're disrupting everything in our bodies. Right? If our bodies don't sleep, they can't repair our DNA and they can't recover. And so that being said, I just want to introduce Dr. Bhandari, and she's going to explain exactly what happens on a physiological level. I'm sort of explaining the phenomenology and an environmental standpoint, and she's going to actually explain what happens inside your body when this happens.
Okay, so what I want to do is I want you to see this chart, and this is basically a way of what the body, the certain hormones in our body, the way they're actually designed to be produced. So the purple is melatonin, the red is cortisol, and the brown is growth hormone. And if you look, cortisol and melatonin are basically in opposites. So this is the daytime, which is basically when you start to produce cortisol and your melatonin goes down. Now you want to remember what is the goal, what does each of these hormones do, because they are very critical to how we function. Melatonin is an amino acid produced from tryptophan in your pineal gland of your brain, so that brain center. And melatonin is only produced during periods of darkness. It is really critical for setting your circadian rhythm, but it also is actually critical for helping food pass through your digestive system, for helping you absorb nutrients, activate nutrients, to help have a healthy microbiome, so it's extremely critical to your immune system. Cortisol is a catabolic hormone. Catabolic means it helps break things down, right? So it's supposed to go into effect when you're under like an acute threat, so you need cortisol. It actually helps us stay alert, be on our game, but you have to time it right and know when does cortisol go up and when does it come down. So when you wake up in the morning around 6 a.m., you're gonna start having your melatonin level dropping. And your cortisol level is going to come up. So around 7 a.m., cortisol is already starting to rise, and it reaches its peaks around 9, 10 a.m. Now during this period is actually when you're going to start to have an increase in your blood pressure. Because when your blood pressure rises, your body's like, hey, it's time to wake up, it's time to deliver blood throughout your body, it's time to get going. So you actually start to become much more alert. You start to have a really strong cardiovascular system as the day progresses. You're on your game. Now cortisol is actually going to start going down before even 12 p.m. And it starts to really bottom down ideally around 7 p.m. And this is that exact juncture, which is when melatonin is just going to start to say, hey, it's time for me to think about, increasing. And that's when, as you think about it, we're not that far off from the sun is going to be setting. So at this juncture is actually our highest body temperature and blood pressure is around 7 p.m. So that's when your body's getting the signal, okay, if the body temperature is up, then cortisol is going to start coming down, and at that point, body temperature is going to go down. So when body temperature goes down, melatonin is slowly going to rise. So by 9 p.m., melatonin is rising, and cortisol should be down here. So when melatonin is rising, the body needs to know, are you going to start going to bed? So when we're talking about those light exposures shut melatonin down. And so the body is saying, okay, if I start to get ready to go to bed, I need to be asleep before that melatonin peaks. Melatonin is critical to go into deep sleep. That is also the same time period, around 10 p.m. to 2 a.m., which is when we do a lot of physical repair. That repair primarily happens at night. So if we are trying to stay up late at night, we miss that really important window of when our body is repairing. And then from 2 a.m. to 6 a.m. is when we do intense psychological repair. This is not going to be happening during the day, because during the day, we're constantly inputting and doing lots of different things. So that repair process is actually happening at night. And so this brown line is growth hormone. Growth hormone is very much connected to the production of melatonin and cortisol. So that way, this alignment is really important to how every cell function occurs. Now, let's say, how does the body know, it's supposed to produce cortisol? Well, typically, the signals actually come from the digestive system, right? Because anytime you're feeling like I'm on my game, right now I'm giving a speech, you feel a little fluttery, right? So it tells our body, oh, you need to be on your game. So the gut actually sends a signal to the brain. And in the brain, most specific, is your hypothalamus, right? So your hypothalamus produces a hormone called CRH, cortisol releasing hormone, which then tells the pituitary gland, which is also part of the brain, to produce ACTH, adrenocorticotropic hormone. And that then tells your adrenal glands, which are these tiny little glands that sit right on top of your kidneys, that you need to produce stress hormones. So cortisol, epinephrine, norepinephrine. And this is a normal signal. And so when this signal is happening, your body says, oh, produce cortisol. So what cortisol does is says, okay, let's increase the blood pressure, because we gotta get blood flowing to every cell in the body. Let's increase blood sugar, because you need immediate energy. Let's suppress the immune system, because we don't want an intense inflammatory response. We don't have time for that. Let's decrease pain sensation, because if you feel pain, you might freeze, and you need to be able to act at that moment. It also says decrease serotonin, so that you don't have an emotional breakdown. You need to act in the moment. And then cortisol, it makes you really just on alert. Your memory, your attention is really focused. And this is awesome, because normally you have an acute event, you deal with it, and you move on. The problem is that what if this is a constant signal that you're sending your body? Then that catabolic breaking tissue down, you really don't want that happening all the time, because you don't want the cortisol to keep suppressing your immune system, and you don't want it to keep making your blood pressure really high or your blood sugars really high, because you can't keep using that for energy. So what happens is that if you look at this chart and you have that on your slide, you see that in a normal state of balance called homeostasis, cortisol goes up and down, just like this chart here, and then it balances out, right? And we function really well. The challenge, though, is that if you are saying, I want to stay on alert, I'm used to having a high production of cortisol, it feels awesome, because you feel like you can handle a lot, and you're like on top of the world. But then over time, there's a lot more work pressures, family pressures, there's environmental toxins, infections, there's our constant light exposures, the system starts breaking down. So what happens then is that our demand for cortisol stays really high. But then the body says, I can't keep it up. So this wiring system of the brain then telling the adrenal glands, you gotta keep producing more cortisol, the adrenals are gonna get tired out. And they're like, I just can't do this anymore. So what happens is the person actually starts to have symptoms. But at that time when you actually will check the cortisol level, it's still in normal limits. So you're thinking, oh, well, I don't know why I'm feeling this way, but really there's problems that are happening. And so this is like a maladaptive area where a person, because they're feeling symptoms, they're gonna self-medicate with alcohol, caffeine, certain medications, because they're like, I need to stay on alert. But the problem is they're gonna keep breaking the system down. And eventually you just get really exhausted. Because what's happening is the adrenal glands are saying, I can't do it anymore. And that's where you're gonna get your insulin resistance. You're gonna start setting in actual diseases because the system's been breaking down probably for months, for years. And that's when we get a lot more of your cancer and other issues that are coming up because the system's been burning out for a long time, but maybe at that time we didn't realize it had been broken and it's harder to reverse it. So what happens then is, you're oftentimes waking up feeling like, gosh, I'm so tired, I can't do it today, or I'm tired all day, I'm irritable because I'm not as sharp, I don't feel as good, I don't handle stress as well. Your immune system is weaker, so you see a lot more autoimmune disorders, for rheumatoid arthritis, Hashimoto's, cancers, allergies, gout, interstitial cystitis in women, to prostate issues in men. Things are just not feeling right. And the thing is that does a person often come back to this is the reason, or do they actually go off to say, oh, well, you actually have all of this issues, and so the treatment doesn't always connect with the actual underlying issue that's going on. Because like Dr. Ball was saying, your sleep is 100% intertwined to every aspect of our function. And this goes from when we're talking about our kids and how our kids are probably not getting the best optimal sleep, so they wake up and they're not as focused at school. We do we diagnose a ton of ADD in this country. We're then self-medicating, but we're not addressing the root cause. That person doesn't feel good and they know it. But if we just label them with a bunch of diseases, we may move far away from the underlying source. So going back to what Lonnele was saying about the light exposures, the bottom line is because the light exposures just shuts down melatonin production. And again, melatonin is really critical to that repair that's happening because it's very intertwined with the production of growth hormone. So there are a lot more newer studies that are showing that if you're often getting this light exposure, we're actually seeing damage to your retina, to your lens of your eyes. So we see increased cataracts, to macular degeneration, which is one of the most common causes of blindness. We're also seeing a direct correlation that if you are continuously shutting down melatonin, your cortisol is going to stay high. And cortisol suppresses the immune system. So over time, what happens is it allows less differentiation of cells, and you get the same cells growing, which are like cancer cells, right? So we've seen a clear correlation between breast and prostate cancer with a lot of light exposure. We're seeing that it really impacts our brain function, so we start having more neurotoxicities. We start having a harder time focusing, having a sharper memory. Our gut doesn't thrive. So what happens is that we actually have the wrong stimulants of am I hungry, am I not? And so we may actually feel like we need to eat, but really we're not needing food, we're needing rest. So we have higher rates of obesity related to like our light exposure. Now this all sounds kind of scary. And a lot of this is, again, related to there are simple things you can do, like really simple things, and they make a world of a difference. A couple of things I would suggest is, one, try to understand how much sleep do you need, right? For babies, they need like 16 to 18 hours. Right?
They're lucky.
Preschool kids, they need 11 to 12 hours of sleep, and sometimes you need more. If you are a school-age kid, you need at least 10 hours. If you're a teenager, you need 9 to 10. And then if you're an adult, you need at least 7 to 8. So I often will hear people say, I function perfectly fine on 6 hours. Yes, in theory, because you're on that constant cortisol high, right? and you're like able to stay up till 4 in the morning and then keep going, you're gonna burn yourself out because eventually the system just tires out, right? So a couple things I want you to just think about in terms of how to just make little shifts. Number one is going back to this is a rhythm that we want to try and respect, not try to manipulate it. So the way I want you to think about it is we are designed to live according to the sun. And so you want to think about what time do I have to leave the house in the morning? Then start an hour earlier at a minimum. That hour is for your self-care time. Not, blending in work and let me just quickly look at my phone or let me watch TV. It's really your self-care time, right? So it's like I'm drinking my water, I'm getting my food ready for the day, I'm gonna eat my food, I'm gonna meditate. But whatever that minimum time that you have to leave your house and you give yourself at least an hour, then what you're doing is you're gonna subtract 8 hours from that. So for example, I have to leave my house at 7 a.m. most days. So I have to be awake at 6 a.m. at a minimum. That means that if I subtract 8 hours, that's 10 p.m. 10 p.m. is, I need 8 hours of sleep time. So 10 p.m. does not mean let's just start getting ready for bed. So then you think about, okay, I need at least an hour before that to actually tell my body that I'm getting ready for bed. And that ritual could include just enjoyable activities such as brush your teeth, drink your water, read a nice book, keep a journal of just gratitude, or reflecting on the day, but not saying, let me just get that last task in. Because if you keep saying, let me do that next thing, you're gonna create that stress response. The next thing you wanna think about is in your sleeping environment, your bed is for sleep or for sex. It's not for reading your books, it's not for checking your phone or having any electronics. It's really, a bed is for bed. And you wanna think about a very cool, dark environment. So with our light exposures, you may think about, run a fan if you wanna keep it really cool. Because in the middle of the night, your body temperature is gonna go up. So ideally, you don't wanna take a shower at night because you're unnecessarily increasing your body temperature and it's going up. So if you unnecessarily increase it, you throw off your production of melatonin. So instead, in the evening, think about that environment that you're sleeping in terms of putting earplugs if it's loud, or if you're disrupted to a white noise through a fan, a patch. Then you want to think about, well, what do I need to do way before? Because remember, melatonin is just going to start increasing over here, and cortisol is going to go down here. So this part here is really important what you're doing. So you want to think about, my body doesn't need a lot of food at this point, right? It's actually here a lot about ketogenic diets because it has to do with fasting, not the ketogenic as eating a lot of animal protein, but it has to do with this, your body needs a lot of fasting this period because when you're fasting, it can do a lot of repair. If you're giving it a lot of food at this hour, it actually can't do repair, it's just doing more work. So it's really important to think about when and what you're eating. So for instance, you want to think about your body needs food during the day because the cortisol is spiking, so it needs the fuel to keep you really alert and strong. So as a day is ending, what you want to think about is 3 hours before bed, you really want to try and fast. And then whatever your last meal is, be conscious of what you choose to have. So heavier items like animal proteins, including fish, sugar, nicotine, alcohol, breads are really actually tough on the system. They don't really give the sleep much value to make it irritable. But also you just want that meal to be really light. And instead, your body says, give me food an hour or so after awakening. Not coffee, but give me a real food. And you can fuel it every few hours. The other thing you want to think about is that every item has a different metabolic rate. So you want to think about caffeine can stay in our system at a minimum of 14 hours. So when you've, let's say, had caffeine at 8 a.m., it may still be there at bedtime. So it's not out of your system, right? So it's keeping it revved up. There's just a couple things to think about on that end. Okay, now, that is all set, great, but I personally think you need some helping hands because I have, as Lonnele said, struggled with insomnia pretty much most of my adult life. And these lifestyle changes are an effort we try to do as much as we can. But life happens and it's not always easy. Some things we do need to stay on our game during the day. So what I want to talk about is what are things you can do to actually help you feel better supported. There's a lot of not all natural stuff you can take. There's some beautiful flowers that help to reset that hypothalamic pituitary axis. So they help you not feel like you're really stressed out. So they calm your nerves, they decrease your anxiety, and they help you to sleep. What you're doing is you're taking these flowers, which again are often in tea forms, and you're steeping it in boiling hot water for at least 10 minutes, and then you can drink it. One of my most favorites is chamomile. Chamomile has actually been used to treat a lot of different health issues, from inflammation, allergies, gut problems, rheumatoid arthritis, muscle spasms, allergies. You can give it to like babies. It's really safe. And if you take 2 to 3 tea bags, you get a really good response for sleep. So it's a nice ritual to have in the evening. Again, you don't want to drink a ton before bed, then you got to get up to pee. It's on the lighter side, but it's very therapeutic for the immune system. Also think about California poppy, lavender, lemon balm, which is part of the mint family, magnolia, passion flower. Lavender has actually been really well studied for anxiety. They've actually some newer studies that came out where lavender, which grows wild everywhere, is actually more potent, if not as equivalent to like your SSRIs like Paxil and benzodiazepines. It's so soothing for the stomach. So remember, when your gut is calmer, you don't overproduce cortisol, right? So then you can then produce more serotonin and norepinephrine and be happy. L-theanine, which is in green tea, is an amino acid which actually produces your serotonin, dopamine production, and your alpha brain waves. So it really helps you feel alert and relaxed at the same time. It helps your muscles to relax, and it actually can reverse some of the caffeine-induced sleep reduction. So you can use it during the day, but you want to be mindful about green teas that have a lot of caffeine in them. Now, really other potent flowers that, again, I probably wouldn't use them for years, but they're very safe for months at a time, is valerian. You also have kava, which is a root that's a really common favorite for Pacific Islanders. It's used to promote relaxation, decrease anxiety, and improve sleep. It's not recommended to use long-term because it could have a negative effect on the liver. And then you have St. John's wort, which also is awesome for just calming you down. It's been well studied for anxiety, depression. It's not, you have to be careful about St. John's wort in the sense of being in direct sunlight, because it kind of causes your skin to be really sensitive. So things you could take at night, which also kind of help decrease your cortisol level and help you not have an intense stress response. One is phosphatidylserine, which is a phospholipid that's a really critical structural component of your nerve cells. The actual extract of it comes from soy lectin. What it does is it tells the brain, especially the pituitary gland, do not produce so much ACTH, adrenocorticotropic hormones. So then that says, okay, I'm not going to produce so much stress hormones. And so when you don't produce so much stress hormones, you actually start feeling energized, and you're happier, and you don't feel like everything is stressful. You also think about glycine, which is an inhibitory neurotransmitter that helps decrease cortisol production. So when cortisol goes down, you start to feel happier, you're not as tired, and you're more energized. You think about melatonin as a supplement. Melatonin has been clearly shown to become pretty deficient as you get older. So we know that if you're 55 and older, you have severe deficiencies. And in today's world, we're probably becoming much more deficient much younger because of all the light exposure. So it's actually been recommended to take it in general as a vitamin because it's so critical to the immune system. There has been a lot of meta-analysis where they looked at 19 studies of 1,683 subjects, and they actually shown that long-term use of melatonin continues to have its positive benefits. It's not addictive. I'll recommend about 1 to 3 milligrams at least an hour and a half before bed. I'll use it in kids, but I'll use a very minuscule dose. And again, the dose varies, but a probably a milligram is good. In kids, I use probably half of that. And then you've got 5-HTP, which is also a metabolite of tryptophan. Which is, again, melatonin is a metabolite of tryptophan, amino acid. 5-HTP helps to produce serotonin, which makes you happy. So when you have more serotonin, more 5-HTP actually increases rapid eye movement sleep. So you actually will notice people when they're sleeping better, they actually say, I'm dreaming more, right? They're going more into that then physical and then psychological repair. So they wake up and they feel rested. They feel like they're just calm and ready for the day. They're not having that sense of like, you're waking up, you're like, wish I could sleep for a few more hours, right? Next category you want to think about are adaptogens. Adaptogens help you adapt. So they help you not to feel like life is really stressful. What they're doing is they're keeping the cortisol level in check so that you are more energized, relaxed. And if you actually take certain adaptogens for at least a month, you actually have better coping skills. So you can adapt to different things coming into your life and not freak out. So my favorite adaptogen is ashwagandha. It's been around for thousands of years. It's a root and leaf that's used in Eastern medicine, and it's very safe. It's great for a lot of different hormonal issues, just to keep you calmer. Then you've got euthero, which is a herb. Holy basil is in the mint family. Maca, which is basically, it's like a stimulant. I love putting people on maca and getting them on caffeine because it has that nice stimulant effect, but without the caffeine problems. So it helps you feel happy, really sharp, energized. It's great for libido, and it doesn't make you feel as anxious. It brings that down. Rhodiola is another adaptogen that also resets the hypothalamic pituitary axis. It interacts with this axis, and it also interacts with certain enzymes that are involved in protein synthesis, nitric oxide, and the immune systems. So during the day, if you take rhodiola, it actually, anytime you're thinking like you would have normally gotten stressed, you're actually feeling that like I'm on my game, but not that I'm on my game because my cortisol is high, is you're resetting it and you're feeling just happier, more focused. Your immune system is staying stronger. It's great for rebounding from intense exercise. And then you think about immune support. So you hear a lot about turmeric. You hear a lot about the medicinal extract of turmeric called curcumin. That is really important for helping your gut, because if your gut is stronger, that means that you're not producing as much cortisol. So with curcumin, because it supports the immune system, it also helps you have a healthy microbiome. And when you have a healthy microbiome, which is all the bugs in your body, you can actually more effectively absorb vitamins and minerals. You're not having an overgrowth of bad bugs, which means that a lot of chronic diseases we're now hearing about are tied to a really unhealthy microbiome. So turmeric is getting a lot more press now because it's so important for the immune system, and it's great for sleep. So now with all that said, that's probably like 20 different things that I just said. You gotta make it easy because you can't take 20 different things because again, you gotta swallow a bunch of pills, but your poor stomach can't digest all of that. So what I've come up with is what is a simple way to put a bunch of things together to get you the effect you want. So my favorite in terms of support is, it's called a combination of valerian, which is your really potent flower that really helps you to feel calm, along with California poppy, ashwagandha, which is an adaptogen, and lemon balm. This synergistic formula is in tranquil response. And I like it because even if you were to say, you know, I don't have any sleep issues. The thing is, though, it's great for people with sleep issues, but it's also great for people who don't have sleep issues because I need that intense restorative immune support happening during the day instead of that person overproducing cortisol all day long or demanding it and can't do it. So I'll usually recommend taking tranquil response, which we have here, at least about an hour before bed. And some people are really wound up, they might definitely need to take an hour before bed. Some people can afford to take it right before, and some people it takes 30 to 60 minutes to kick in. And what it does is that it lets that person go into that deep restorative sleep, so I get that physical repair. Because if I don't get the physical repair, I'm not going to get that psychological repair that is very important. So when they wake up in the morning, they're actually not getting that daytime drowsiness that happens with a lot of your prescribed sleeping agents like Ambien, Lunesta, Benadryl. Those are harder on the liver, they're dehydrating, and they do cause you some sort of a slight brain fog in the morning. So you don't want that effect. You really want to feel on your game, but you want that restorative effect happening at night. The second one I love, which I'll recommend to all ages, is sleep reset. So that's melatonin, because you hear a lot about melatonin and people try it at different ways, or they'll say, yeah, it totally makes me sleep, or it causes me really vivid dreams, or it didn't work for me. So it's important to know how it works, and that a little can go a long way. What I like to do is actually remember that melatonin is for immune support. So I don't actually tell people just take it for sleep, because I know it works differently for different people. So I like the combination of using sleep reset, which is a lot more immune support. So it's melatonin, the amino acid glycine, 5-HTP, which is a precursor for serotonin, L-theanine, which we talked about, was that amino acid in green tea, and then curcumin and vitamin B6. So this is all actually about immune support. So it's resetting this system that's really gotten wacky. And the way it works is it helps you to fall asleep and stay asleep, and then you don't wake up groggy. But it's that intense work that I want to happen in the middle of the night. And so I'll actually say, these are these packet drinks that you open it up and you just put a little sprinkle in like chamomile tea or in warm water, but you do it at least an hour and a half before bed. The people who are really strung up and have a hard time settling down, I'll have them do it even 2 hours ahead. And I'll have them actually put a little bit of magnesium powder, because magnesium is very critical for how your body works. Because magnesium makes the blood sugar go down, right? And remember, when cortisol is high, blood sugar stays high. Magnesium is important for keeping your heart safe, having a good electrical rhythm. It's great for detoxification, to clear that gunk, all those heavy metals and toxins that we're all getting exposed to. So I'll recommend take like a cup of chamomile or valerian tea, put a little bit of sleep reset, like 1/4 of a packet. And if you have magnesium powder, it works really well. And you do it when you're not sleepy. You do it part of your ritual of like, this is just what I do before I go to bed, right? So you're resetting that signal for your body. And then I think about, well, what about the people who like, they can fall asleep, but they can't stay asleep. They're really just strung up. So we mentioned phosphatidylserine, which is a really important structure of your nervous system. So phosphatidylserine has been well studied for helping people to feel less anxious and not produce a lot of cortisol. So I like Integrative Therapeutics Cortisol Manager because it's a combination of ashwagandha, an adaptogen, magnolia, which is a flower, and phosphatidylserine. So the way I use Cortisol Manager is, I like it because for people who are really stressed out, it's great to take in the middle of the night when you wake up, and you don't want to take a sleep aid at 2 in the morning because you got to get up in 4 hours. So that works really well for those individuals. I like it also in the day, in terms of if you're like really stressed. I don't like prescribing your benzodiazepines like Valium or Ativan, or because there's a lot of issues with them. And the Cortisol Manager helps people to keep that cortisol down in the middle in the day, and you can cut them up in pieces so that you can take it, you stay focused, you're calm, and so as evening comes around, your cortisol is not at that higher level, we're bringing it down, right? So that works really well. And then what about in the daytime, right? So we talked about that you want to be on your game, but you don't want to wake up feeling like I have so much to do. So you need, instead of having that caffeine that you're always going to wake up, you think about, well, I mentioned rhodiola and maca, which are great for your immune system. So HPA Adapt is awesome for that because what it does is it takes the rhodiola, the maca, the ashwagandha, the holy basil, and mixes into one. And you can just, there's your capsules, you can open them up. So like if it's, let's say you have a teenager and they've been up since midnight, they were up until midnight studying, and then they have to be out of the house at 7, and they're like tired, like how am I gonna do this? Or they're playing sports, and they're like, how am I gonna recover? Because when you're tired, you have a higher chance of injuries. You're gonna have more health issues, right? so in general, if you have something that tells your body, please reset this brain gut axis and calm the whole situation down, then you need that support. So I'll recommend take like 1 capsule in the morning. If you're really strung up, then you take 2. And if you're still feeling not like amazing, then you take it again at lunch. With kids, I'll actually open the capsule and we'll put it in water and they just drink a little bit and it goes a long way. It also doesn't cause any of the negative caffeine-induced sleep reduction. So I love using this to try to get people off of caffeine or to at least delay using caffeine first thing in the morning. Because the caffeine prevents their ability to absorb any nutrients. So a lot of times people drink it first thing in the morning, but now their body is staying very malnourished. So if I could delay that, then at least the body's getting the food and using it for energy and feeling like they're still really well supported. Okay. So Lonnele is actually going to talk about wearables and sleep coaching because again, I think a lot of this information you're getting today, you need to have it personalized to you. And so it's kind of recognizing a couple different ways that we can help guide people and really create a personalized approach.
Thanks, that was amazing. It's good to know these alternative options. It's nice to have these options and it's nice to have a little support along the way. Because oftentimes what we're trying to undo is a lifetime of behaviors that are impeding our sleep efficiency, our sleep quality. And that's really where sleep coaching comes in and cognitive behavioral therapy. And essentially what we do is we work with you or the individual discussing sort of those thought patterns or behaviors that are preventing you from sleeping well. And we talk about specific nighttime routines, bedtime routines, similar to those that Dr. Bhandari discussed, setting yourself up for success at night. And we talk a lot about sleep hygiene. And the other piece of it is we talked about sort of all of the light pollution and the electrosmog. So we actually physically arrange your bedroom environment where we're minimizing the exposure to not only light, but electronics and electromagnetic radiation. And these are precise skill sets that most of us don't have. And it takes a while to learn this, but it's very easy in terms of a behavioral modification that will greatly impact your sleep. And using blackout curtains, they're really just behavioral interventions that make a profound difference. In terms of the electronics, we can also teach you how to ground your body so that you're not part of what happens with the exposure to electromagnetic radiation is that activates this cortisol axis, which Dr. Bhandari just spoke about. And so what we do is we also intervene with grounding mechanisms where we have actual mats that ground you. It turns out our brain and our heart has an electromagnetic frequency, and it's similar to that of the earth, which makes sense, right? We were evolved to live here on this planet, to not live in concrete and to be out in the sun. And so we now have technology that allows us to restore our heart and our brain to that of the earth as opposed to that of our cell phone or our Wi-Fi or our computer. And so there's those options. There's also learning how to turn off your Wi-Fi at night. There's devices that we now have that can disrupt the electromagnetic radiation from your phones, from your computers, from your Wi-Fi. These are all really, really important things to get the bedroom environment good and healthy, and not just for you, but your children. And that's kind of my big concern is what are we doing to our children in terms of disrupting their sleep? And think about how much radiation goes into our head, and our children's heads are so much smaller. And there have been studies done where the radiation actually goes all the way through the head for children. And so we really, really have to be mindful about how we live in a modern society. And the best way for me to keep track of how we do this is through these continuous monitoring sensors. These are wearable technology sensors that we use. And there are a number of different technologies we can use. We can use watches, we can use rings, and we can personalize it according to your needs. And what these allow us to do is track you continuously. We know when you're sleeping, we know when you're waking, we know what your heart rate variability is, what your skin temperature is. sleep studies has been to bring people in clinics, and that doesn't really recapitulate what we do at home, right? I want to know what happens at home, because that's where we're going to make the most impact. Let's figure out what's going on in your environment. And the only way to capture that is with these wearable sensors. And so these have just been a godsend for us in terms of monitoring and guiding people through sleep quality, sleep efficiency, and back to health. And I'm going to pass them around actually. Can I pass it around? Is that okay? Okay. So this one is our very favorite one. This is a state-of-the-art instrument that just rolled out. It actually has continuous glucose monitoring as well for our patients with diabetes. It's the most robust medical device I've seen, and it actually has a built-in biozen, which is a device that basically deflects all of the EMS, which is why we use this particular device, because we don't want to expose you to more EMF. Like this, forgive me, Apple, but I really cringe when I see our patients on the iWatch, because every time a phone call is coming in, guess where that radiation is going? Not good. Okay? So again, we do have devices that we can provide that will mitigate some of that, but the ideal scenario is to have something like this that has far more robust measures, but that helps us keep you on track. Now I'll know if you have a difficult night of sleep because I'll see it. It's continuous data stream, and I can reach out and we can talk the next day, and that's part of what sleep coaching is. It's every day is a different day, every night's a different night, and it's about having that support, because again, we're undoing a lifetime of poor sleep behaviors and poor sleep hygiene, and it doesn't happen overnight, but it does happen, I promise. And it's really nice to have this, not just for you, because you'll see your progress. You can map your sleep, and as it gets more and more efficient. So this particular device, it's not just an accelerometer, but we know sleep quality. We know, how long you're in deep sleep and which stage of sleep, which is incredibly useful. Again, we used to only be able to do this in the clinic for sleep studies, and now we can do it in the privacy of your own home. So I'm going to pass this around. Dr. Sal's already seen it. That's our particular favorite one. This is a new one that's also come out, and this one I super love. This one is very unique for female physiology, and that this is called the AVA, that's called the ELO. The AVA is particularly useful for women that want to track their cycles, and women that want to conceive, and it also tracks pregnancy, and they're now moving into studies to be using it for contraception, so there's no more like rhythm. Again, this is all by measuring biometrics, so it measures your heart rate variability, and it only does it when you're sleeping, because it makes good sense. When you're sleeping, that's when it's the most consistent, right? Not during the day when you have different activities going on. It will measure, cardiac function is often regulated by your ovarian hormones. So we all know that maybe some of us know that estrogen is cardioprotective or it can be neuroprotective. And so based on that, we can use these wearables, and we can use them safely, particularly in people that are trying to conceive. So that's a fantastic tool that I'm super excited about as well. Just very new. They now have 10,000 pregnancies that's been logged on the AVA. And great thing about that, it doesn't have a biozen built in. I was just talking to a patient today, and it was a bit inconvenient because it's not synced to the cloud. It's not getting that EMF, right? It's not constantly syncing and pushing data out there. And the patient found it to be a bit, frustrating because
That's me.
I
want to go now.
And because we're used to, our iPhone syncing in the morning, right? Or whatever, or iWatch. And the reality is, I said, you know what? That's why I chose this, because it doesn't sync because it's not good for your body and it's not good for your baby. And that's the way it should be. So it's not always about convenience, it's about safety. So I just want to pass these around and show you these and let you know that there are these resources out there, and that there's so many more alternatives that are going to get you to the place you want to be way before the pharmaceuticals are, in my opinion. And I'm only telling you this because in the last slide, I just want to share with you that we have been doing these exact sort of studies with cancer patients. So as you can imagine, having a diagnosis of cancer is quite traumatic and quite stressful. And so because of this, many cancer patients have PTSD, which is is of course going to disrupt your sleep, but they also have what we call chemo brain, which is a lot of the chemotherapies activate cytokines in the brain, which activate your sleep center, and so they can't sleep. And it's, you know, oftentimes they end up, you see them on Ambien and these benzodiazepines, and it's just a downward spiral. And so what we've started to do now, using devices like this and using integrative medicine, acupuncture, sleep hygiene, sleep coaching, what we're seeing in cancer patients is increased quality of sleep efficiency, increased circadian health, and improvements in survivorship. So I just want to say, you know, if we can do this in cancer patients, we can certainly help all of us to get to that point. There's a lot of hope, and we're here for you. And we really appreciate your attention. And I believe Dr. Bhandari has some amazing samples to try.
Yeah. The orange yummy drink is called Sleep Reset.